Hi, this is Michele Lawler. The skills described in Chapter 7 and on the Leadership Skills Questionnaire, I scored 23 in administrative skill, which is in the high range, a 23 on the interpersonal skill, which is in the high range, and 26 on the conceptual skill, which is in the very high range. So for that, to secure needed resources, such as staff, the conceptual skill and actually all three of these skills would be important. Interpersonal would be in finding the staff either through a float pool or through a PRN type of situation. Conceptual would be in seeing the big picture and knowing what the staffing needs are for the unit, the patient acuity and the census. In my position, I work in an ambulatory unit. In a OB office. I manage 2 OB offices. So just knowing what the schedule is for that week for the doctors, what the surgery schedule is for that week, and being able to really see the big picture, know what the staffing is, and then also anticipating for any type of call outs for anybody who's sick or has, children who are sick or anything like that, and knowing what resources I have. We don't have a float pool like we do in the hospital. There's a float pool that you can call for PRN staff. And we also have a specific PRN float pool just for labor and delivery that we can utilize in the hospital. In the ambulatory setting, I happen to know that one of the other OB groups, who is 2 floors down from my group, has extra staff. So, for example, if I needed staffing for tomorrow, because today's Sunday, so if on Monday morning I needed extra staff, I know that I could call the other OB office and see if they have extra staff that are available, which they almost always do, that could help staff our office. For the published literature, I have, and this is, I'm already employed as a manager, so this would be how would I use this to function if I advance to a higher level management position. So the interdisciplinary model, leadership model, is designed to leverage organizational resources by combining clinical expertise. That's a collaboration in our hospital between the Department of Nursing and with the chief nursing officer would be at the head of the organizational chart, senior vice president of nursing and patient care services. So for me, just to grow as a leader, it would help in trusting in the quality working relationship, knowing that I have different resources that I can call on within the nursing organization, that are not just my one-up, but her superior, and follow the chain of command that way. There's shared responsibility in joint decision-making within the transdisciplinary model. There also is mutual respect in the transdisciplinary model. You have a better working relationship with other disciplines within the organization, not just within nursing. And communication facilitates sharing the patient information and knowledge, and just general cooperation and coordination of care throughout the organization. The levels and departments I would need to work with in order to be effective in my role. For me, currently, I'm transitioning from the hospital to the ambulatory setting. So we work closely with the hospital, so I have those contacts throughout the hospital. Since I just came from there, the nurse managers, the CULs, which are the clinical unit leaders, and then in my office setting, there is a clinic administrator, there's a physician who's the head of the entire physician's office, and then the clinic administrator who is in charge of both the clinical and the clerical fiscal side of the clinic reports to her. And then there's a clinical supervisor, which is my position, and there's a clerical supervisor, and the clerical supervisor is over all the front desk staff, the billing, referrals, check-in, check-out, scheduling. And then my position as the clinical supervisor, I am in charge of the clinical staff, the medical assistants, the sonographers, the triage nurses, they would all report to me as a clinical supervisor. And then obviously physicians, because we are a physician's office. So that would be the levels and departments that I would need for my role. I'm trying to think if there are any other departments. We don't in the office tend to use transport as much as that's something that we used a lot in the hospital was transport. Because we have our own ultrasound techs in our office, I don't need radiology like I did in the hospital. So that would be for the ambulatory setting. And then for the vertical or horizontal structure, my hospital, Nova Health, is vertical. And I do think I prefer that only because that's what I've worked in for such a long time. I think vertical organizations are very efficient. The chain of command is very clear. It's direct. You know exactly who can make decisions, whose responsibility it is. You can always go up the chain of command and you know exactly who the next person is in that. They're clearly defined. The tasks are very specialized. Horizontal organizations, I know, are more flexible and don't have as much power, I guess, at the top of the organization. And there could possibly in that way be more teamwork because you feel like more like you're part of the team and not like you have your own little, box that you have to work in. My hospital is pretty flexible about moving up the organization. They have a very strong training for leaderships, and they're always looking to promote from within and to move people up in the organization. So for that question, my preference would be the vertical structure. And even though that is a traditional structure, that's something that I have found to work for the last 14 years that I've worked for my organization.